Now we're looking at a very special case in cancer of the cervix. All right. So this is after you do a hysterectomy. Hysterectomy, right? I'm cutting out the uterus. Okay. So if you cut out the uterus and you leave the cervix, you can cut out only the uterus, or you cut out plus the fallopian tubes and the ovaries, right? So if you leave only the cervix, there's a possibility now that this cervix that you left behind can develop cancer. So let's look at possible reasons, okay, to how this can happen. So it just refers to development of cervical cancer in the remaining portion of the cervix after you remove the uterus, but it was partial, or they call this subtotal. Okay, so this is where the uterus is removed but the cervix is left. All right, so though it is rare, okay, but it's something worth discussing. So what happens? Residual cervical tissues remain vulnerable to human papillomavirus infections. Okay, so maybe inadequate follow-up, maybe there was cancers in the uterus. Do you understand? Maybe the cancer have spread a little bit to the cervix and there was no better follow-up, you know. So persistent human papillomavirus infection. So the person is having back-to-back infections from human papillomavirus. Okay, this can also be an issue. So clinical features is the person is usually bleeding after, sex, or abnormal vaginal bleeding, vaginal discharge, foul smelling, pelvic pain, pressure, pain when having sex, urinary or bowel symptoms in advanced cases. So diagnosis is pelvic hair examination, pap smears, you do colposcopy where you observe and send some tissues to the lab for biopsy. So you can also do imaging, which will help you to now know the stage at which the disease condition is at. Okay, so treatment does depend on the stage, but you can employ things like surgical, just now remove the cervix, or chemotherapy or radiotherapies.